So what pain management formulations are you offering or making in your pharmacy?
Pain is one of the things that we do a lot of, because most people find out that when they take medications orally, they have so much side effects from it.
Okay.
One of the things is like if you take Motrin for too long, it causes disruption in your GI tract.
Okay.
And if it's not being addressed, you could have a situation whereby you're having an ulcer. So one of the novel thing that we've done in my pharmacy is that we actually be able to put a non-steroidal anti-inflammatory drug like Motrin in a topical gel, whereby you could apply that gel directly to where the pain is.
And it works.
That works like a charm. It works very well, and people love it because now they don't have to take the medicine orally, causing all these GI side effects. They could get this gel, apply it directly to where the pain is. And we've done a lot of combinations. We could apply a muscle relaxant to the gel. We could apply a local anesthetic to the gel. We could do an application whereby you have things to calm the nerves down for people with neuropathy, because that works very well because they are applying the gel directly to where the pain is. So they don't have any systemic effect, but they have much relief.
Now I know that you get a lot of referrals from pain management physicians in the desert. For those that aren't using you, and maybe they should, what do you want them to know about maybe some of the things you offer? And maybe even the ones that are using you lightly. Is there anything that they're not aware of, maybe that you do?
I want them to understand that because we understand pain. Pain is what the patient said it is.
Okay.
We're not here to judge the patient. They've gone to a healthcare professional, especially with the doctors that we work with in the area. They actually been evaluated and prescribed that. When patient walks into a pharmacy, we don't judge them. We don't see them like drug addicts.
Okay.
We don't, because to me, that's not good, because it's like you judging people before you even get to know them. The fact that somebody is on a pain med doesn't mean they are drug addicts. It could be they just had surgery.
Yeah, they want to get out of pain.
So you don't have to prejudge people. Give people the benefit of the doubt, and that's one of the things we do in my pharmacy. We don't judge them. We see them as a patient that needs help, and we tend to help them. And at the same token, when we see prescriptions that are really fraudulent, that doesn't look right, we don't hesitate to tell that patient that we can't fill that prescription either. There's going to be some bad apples that they're not taking the medication for a good reason.
Okay.
And those people, we weed them out very quickly.
We have systems to weed them out.
We have systems to weed them out. So, but I want patients to be to understand that we embrace them, we don't judge them, and the doctors to feel comfortable that we don't overscreen their prescriptions, especially those doctors that that are actually in the area locally.
But isn't it true though? Because I heard this from a pain management physician in LA, in Los Angeles. He said the problem, if I send somebody to a compounding pharmacist, he's going to load them up with a bunch of supplements, he's going to tell them to take hormones, he's going to try to get them off the medication, he's going to second guess me, and it's a big nightmare.
We actually don't do that.
Okay.
I want those doctors to understand that we're very professional. To me, changing a doctor's prescription is very unprofessional.
Does it happen?
Sometimes some people do.
Okay.
And to me, I wouldn't do it. And I have zero tolerance for that.
Okay.
Because one of the things I always emphasize is that we in the healthcare profession, we have to work together to take care of the patients. That's the most important thing. The patient has to be taken care of.
So the original question though, because I think you said before, you don't want to upsell them with a bunch of things.
Yes.
If they send you a patient.
Yes. I don't want to upsell them. I want to give them what the doctor wants them to have. Okay. There's a difference with a patient asking for something. When a patient asks you for something, you got to be able to help them. Yeah. That's not upselling. That's helping a patient to get better. And one of the things I want the doctors to understand that we actually, I have a lot of respect for all the doctors in the area. And the respect is actually mutual as well.
Good.
They respect me a lot as well.